We probably work with more million-dollar plus or multi-million-dollar practices than anybody that I know of in the U.S. I'm going to tell you how easy it is to make $1 million, and you can plug the numbers in for $2 million, however you want. All it takes to have $1 million practice is 1,100 patient files. That's it. That's it. 1,100 patient files. It is so easy to have $1 million practice. You need 1,100 patients, and you need $910 worth of production every year. And you go, well, heck, that's a lot of production. $910? No, you're exactly right. It's not a lot of production. Let's break it up. $910 worth of production times 1,100 patient files. How does that look? Well, if you got 1,100 active patients at 2 visits a year, a prophy, let's say $60. Is that reasonable? Is $60 higher than anybody else in the room? Is that a conservative number? Can we agree that's a conservative number? Okay, 2 prophies a year. If you do insurance, that's paid for by the insurance. You don't have to sell anything, right? That's $120. If you do an exam, is $45 a conservative number for exams in your area? I don't know. You guys tell me. So can we agree these are conservative numbers? Insurance pays for that if you take insurance. X-rays $50 an hour at $260. Whoops. Now let's assume one major procedure. Is there anybody in this room who charges less than $650 for a major procedure? Good. Okay. So we can agree that that's a conservative number also. Now you're at $910. And that's it. That's all it takes. And if you're not where you want to be, I can tell you, figure out what's going on here. If you've got, what we find is a lot of times people, offices will have twice as many patients, but they're not caring for them on a recare basis, number one. And number two, they're not getting them enrolled into their treatment. Now, the truth of the matter is, if your fees are better than this, guess what? You don't need 1,100 active patients. And if you want to have a $2 million practice and keep the numbers the same, it's only $2,200 patients. You ought to have, for every single doctor, you ought to have 2 full-time hygienists, and we'd like to see you grow that to 2.5, or 2 1/3, or 2 1/4. In my little example here, it could look like 1 doctor, 2 hygienists full-time, and then what we call a co-therapist. A co-therapist would be somebody who does, in Tennessee, I believe, an assistant can do polishing and X-rays and all of that. I would have this what we call a co-therapist do all that stuff, but more than anything else, I'd put that person in charge of hygiene, what we call reinstatement. That means confirmations. That means recovery of people who've fallen through the cracks. That means setting appointments. That means creating the relationships. And so she can do all of that and assist the hygienist as well. Clinical assistants possibly 2, and 2 at front desk administration. If you don't have insurance, you may not need 2. If you have insurance, you're going to need 2 full-time. Overhead expectation, less than 60%. Less than 60%. You ought to have 40% profitability. Now that means then that out of that 40%, hopefully the doctor's getting paid. Hopefully you're paying off practice debt. Hopefully you're paying off personal debt. Hopefully you're putting money back for a rainy day because you know you're not going to collect it consistently. Hopefully you're also paying off equipment purchases and future purchases with all of that 40%. Nobody's going to look after your money, including your CPA, like you. Pull it daily. Track it daily. You need to know that we produced $1,000 worth of dentistry in this amount of time today, and here's how much we collected. Because those are your benchmarks. Those are your matrices. That's what you're measuring against. There's tons of opportunities there. Here is the only way that you can grow your practice. If you think your practice is a big old bathtub, you know what? Everybody wants new patients. Well, I hope you've already seen that new patients will help you get there, but if you're not re-caring for those patients in a consistent manner, you drive yourself crazy trying to get new patients, and they never stay in the door. If they never stay in the door, you're not making any money off of them. Honestly, it's not about the money, but seriously, if you're not making any money off of them, you're not taking care of them. You're not taking care of them. It's crazy. The national average, believe it or not, of patients in a consistent preventative maintenance program, this is going to blow your socks off. It's 40%. Now think about that. According to the ADA, 50% of the population does not have a dentist. The 50% that does, only 40% are coming in on a regular, consistent preventative maintenance basis. You know what? We ought to all be shot. That's ridiculous. That is absolutely ridiculous. How in the world can we say we're taking care of these patients? Now again, we talk in terms of money because that's the way you measure stuff. But if you're making money, the patient's winning. And if you're not, they're losing. So, be selfish. Try to make some money because they're going to win. It's not okay for 60% of your patient base not to be coming in every 6 months or whatever your layout is. 4 months, 3 months period, whatever that looks like. There's a whole other area that most offices don't even look at. Things like frequency, things like additional treatment, things like cash cows, products and services. You must get control of the things that you can control. And if you do not, the things that you cannot control will absolutely control you.